Hi, I'm Glenn Robertson, and the theme of today's TEDx event is Creating the Imagined. So imagine, if you can, a world where heart attacks have become as rare as mumps and measles, where strokes almost never occur, and where type 2 diabetes is eliminated. Just after being elected, I suffered what I believed was my first heart attack. I ignored it, and then weeks later had the big one. I had open heart surgery, and then after another month, I had to have a stent. I was in bad shape, and the prognosis was bleak. But then I learned of the Bale Doneen Method. Their practice focuses on prevention and remediation of heart disease by physical exercise, diet, and targeted medicines. Now, less than a year later, my heart disease, while not being eliminated, is being controlled. Dr. Bradley Bale imagines a world where diabetes, stroke, and heart attacks are in retreat, and he's creating it every day. Ladies and gentlemen, Dr. Brad Bale.
Yeah, we have something very exciting to talk about today. We now live in an age where we have the technology to identify and the knowledge to halt arterial disease. That's a big deal. We're all surrounded by the consequences of arterial disease. Everybody knows someone who's suffered a heart attack or a stroke or has developed dementia, kidney failure, etc. We now no longer have to know that type of event in an individual person. We do possess the knowledge to stop arterial disease. It is the biggest killer and the biggest disabler out there, and it's also bankrupting our healthcare system. So this is fantastic news to know we can stop it. We can maintain the wellness of our arteries. This developed through knowledge that's been acquired over the last several decades. We now know the inside lining of the artery is arguably the most important structure you have, because it has to fail twice before you're going to suffer the consequences of a heart attack or stroke. The first failure is when it starts allowing cholesterol to seep through into the wall of the artery. And it does that silently. You don't know that that's happening. And that collection is potentially very dangerous. We've called that seepage into the wall of the artery, better known in the medical world as plaque. We call it the cat in the gutter. That disease gets in there just like this cat in the gutter that can leap out at any moment and grab one of those unsuspecting pigeons. That's exactly what's happening in the wall of our arteries. And we hired a cartoonist out of New York, Moss Friedman, to develop these pictures to share with the public. The second failure that has to occur with that inside lining of the artery is it cracks or breaks, and it allows that cat to jump out. And that will create a blood clot. The clot may get so big, you know what happened. You have a heart attack, or you have a stroke. Or we now know the vast majority of the time that happens, you develop a clot that's so small, you don't really know what happened. And it'll migrate down further stream and end up damaging some of the heart or the brain, and you'll eventually realize that's happened with heart failure or dementia. This is an example of what I'm talking about from someone who actually perished from a heart attack. You can see the hole for the blood flow was huge. There was no obstruction of that hole from that cat in the gutter. What happened, the surface above the cat in the gutter broke in two places. A subsequent blood clot filled up that artery, the hole for blood flow, and actually caused the demise of this person. And this is the most common type of scenario, where the hole's wide open right up until the moment of that event, which can be fatal. So it's no mystery, and we all know people who've been placed on a treadmill, they feel fine, but maybe they have a family history of heart attacks. We'll find out if you're at risk. We'll put you on a treadmill. They pass the test with flying colors. They're told they're fine, and in a relatively short period of time, they have a heart attack. There's no mystery to that. We've known for over 15 years the hole is usually not obstructed right up until the moment the cat jumps out of the gutter. So recommending that test in an asymptomatic person to identify if they're at risk for a heart attack is as antiquated as a physician recommending cigarettes. It's no longer a requirement that you have to have a heart attack or stroke to notify us that you have arterial disease. That's as ridiculous as this fire alarm system in this cabin, where you're going to wait for the cabin to be on fire long enough to pop the popcorn, and then you're going to grab the fire extinguisher. We've moved way beyond that, and that's wonderful. We now have technology that can painlessly and inexpensively tell us if there are cats in the gutter. This is an example of the carotid ultrasound. You can clearly see a cat in that picture. We can also do rapid x-ray of the heart. So rapid it basically freezes the heartbeat, so you get a clear picture. And we can see if there's calcium in the arteries supplying the heart with blood. If there is, you've got a cat in the gutter. And if you have a cat in the gutter, you have risk for a heart attack or stroke. And we know from a study done 12 years ago, you cannot ignore it. They did a study with 10,000 people looking for those cats in the gutter. The ones that had it had to get in the study, had to agree not to receive any treatment, even if they found disease in the wall. Within 10 years, 40% of those people suffered a heart attack or a stroke. If you find a cat in the gutter, disease in the wall of the artery, you can't ignore it. It needs to be managed. And a method that my partner Amy Doneen and I have developed is anchored on a platform of looking for disease, identifying disease in each individual person. That's a requirement to have an event. Risk factors don't cause events. Disease causes events, and we can do that now. We have the technology to do it. And we've redefined prevention. Primary prevention to us is we've looked as best we can at that person. We can't find disease. We don't ever want them to get it. And we can prevent them from ever getting disease in the wall of their artery. Some people we find disease, but they've never had a heart attack or stroke. We can keep that disease from ever causing a heart attack or stroke. And then other individuals identifying the disease, they make it easy for us. They did have a heart attack or stroke to prove they had disease, and we're going to keep that cat in the gutter forevermore so that they don't have any more events, because we can halt the disease. We now possess the knowledge to do that. It's extremely exciting. To halt the disease, we now understand arterial disease is an inflammatory condition. That was first proposed 157 years ago by Dr. Virchow. It was reinforced in 1999 by Dr. Ross, New England Journal of Medicine. The earliest lesion is a purely inflammatory lesion. And then it was confirmed a year and a half ago with large genetic studies telling us unequivocally inflammation is the cause of arterial disease. And we have inexpensive urine and blood tests that can tell us how inflamed the artery is. How on fire is it? And if it's on fire, that fire needs to be extinguished. To keep the body warm, we have to keep the arteries cold. If you get hot arteries, your body may get very cold. So in order to cool off the artery when it's hot, we have to uncover all of the causes for the inflammation. Get to the root cause, identify it, and manage it. And we can do that. And there are lots of root causes, potentially. One of the ones that people are very familiar with, because it's gotten a lot of attention, of course, is cholesterol. And cholesterol can inflame the artery. And it's not just this LDL that gets all the attention. There are actually 4 bad cholesterol hombres. LDL is arguably the wimp of the bunch. But we can assess all of them, all the bad guys, and we can deal with them. We can take them out of the game. But if we take them out of the game, a lot of these people are still going to have active disease because there are numerous other reasons they can have inflammation in the artery, from smoking to not sleeping well enough, not eating a good diet, not being physically active, being diabetic or pre-diabetic, having oral disease in the mouth, having low vitamin D. So there are lots of reasons for inflammation. And in each individual patient, we can figure out which ones they have, and we can manage them. I'm just going to point out 2 in particular because they're so common. They're as common, if not more common, than cholesterol for causing inflammation of the artery. One is being pre-diabetic. And you're pre-diabetic before you're diabetic for 10 to 20 years on average. That's a long time. And we've got simple tests. We can figure out who those people are. And we can address that, stop them from going on to diabetes. That's pretty nice. But in addition, it helps cool the artery off, helps halt the arterial disease. The other big dog in the cardiovascular world is oral infection. Both periodontal disease and infection in the teeth are now known to be associated with heart attack and stroke risk. And we have objective tests that dental providers can now utilize to make sure there's no oral infection that could drive arterial disease. It can be managed. We can manage all the reasons for arterial inflammation. We can put the fire out in the wall of the arteries. We can put the heart on ice. That's wonderful. We can stop the disease. And when you halt the disease, the body will heal itself. Give it time, it'll heal. Those cats, they'll get all calcified and scarred to the point they're not jumping anywhere. That's wonderful. But we do need to maintain vigilance forever on the inflammation of the arteries. Just like Abraham Lincoln stated years ago, with vigilance, go forward and we will gain victories. The Chinese told us where we needed to be with healthcare over 4,000 years ago. They stated superior healthcare providers prevent disease. Mediocre providers treat the disease before it's evident. Inferior providers treat the full-blown disease. Due to lack of the technology and lack of knowledge, our healthcare system had to be set up on an inferior platform. We had to wait for a heart attack or stroke and then deal with it. We no longer have to do that. We can migrate to a different platform where we all become superior and at least mediocre providers. That's wonderful news. It's never too early to find out if there's arterial disease going on. It's never too late. Even the people who've had heart attacks and strokes need this type of attention, a holistic approach to assess why there was inflammation in the artery and put that fire out. We now possess the knowledge and technology to offer every individual the opportunity to live a life free of devastating arterial disease. I can't think of any better news. Those are my granddaughters. I'm so pleased that we now can make sure they never have to suffer the consequences of horrible arterial disease. Our method, we believe this so deeply that 4 years ago we started guaranteeing our work. We believe in each individual patient we can identify disease. If they have it and there's inflammation, we can find out why. And we can manage all of those issues to extinguish the fire. The disease will halt, they'll be able to live out their life without the consequences of terrible arterial disease. So thank you. I hope you're as excited as I am about this. It's my pleasure to present this information to you. Thank you very much.